basically obliterated those differences. And so, but we still thought that yoga might be an effective means of improving vascular function or attenuating dysfunction because of the correlations between flexibility and stiffness. Stretching has also been shown to reduce arterial stiffness, and isometric training has also been shown to enhance endothelial function. So the part of Bikram yoga specifically that we have not talked about yet is the thermal therapy or the heat. Okay, and that's one of the things that sets it apart from other styles of yoga is the 105 degrees. Is there anyone here who doesn't practice? I'm just curious. Okay, so there is one. There is one in the room. Maybe you'll start after today. Okay, so this is a study that's showing how sauna therapy alone can have some beneficial effects on cardiovascular disease risk factors. And what else is it but a sauna when you come into a room and it's 105 degrees and the humidity is cranked up? That is essentially what it is. You're doing yoga inside a sauna. And so this is just one of several studies really that show the beneficial effects of sauna therapy. And so this is in a group of people with various risk factors for cardiovascular disease. They did sauna therapy once a day, every day, 7 days a week, 14 sessions. They did it for 2 weeks, okay? And what they saw at the end was that both systolic and diastolic blood pressure went down. Fasting blood glucose also went down significantly. And FMD, or flow-mediated dilation, significantly increased at the end of just 2 weeks of sauna therapy alone. Okay, and this is just coming into this room and sitting here and not even doing the yoga, you know, that you could potentially maybe see some of these effects. And so with the final few studies that I'll talk to you about, this is now when we get into the Bikram. So I asked these questions: does Bikram yoga enhance arterial compliance and flow-mediated dilation in young and older adults? So I actually had 2 groups for this study. This one was slightly different. So I had a group of young adults and then a group of middle-aged and older adults over 40. And so if so, you know, yes. Golly. No. I want to give you the exact number and I can't remember. I wonder if I have it on. Yeah, 18 to 39 and 40 to 70. Yeah, I have it on the next slide here. Yes. Okay. And so, and if there are any beneficial effects, will they be more pronounced in the older adults? And we thought that they would. Okay, because that just made sense, that the people who started with elevations in arterial stiffness would stand the most to gain from the intervention, right? You would just think so. Okay, so we took a group of 42 sedentary men and women. Again, we had a group of young, 18 to 39, and a group of older, age 40 to 70. About 13% were male in the younger, and then about 28% male in the older. So we actually were able to get some men to do the study, which was wonderful. And we had a long list of exclusion criteria, which I won't even get into necessarily. Anytime you do research, you have to submit the protocol to what's called an institutional review board. And so there are medical and health professionals on the review board, scientists, and so they're very strict in terms of just making sure that what you're subjecting the people to in your study is safe. And so I sat down with a few physicians and came up with a long list of exclusion criteria, just for the sake of, keeping it safe, but also getting it through the IRB so we could actually do the study. And so, in addition to the vascular health measures, the arterial compliance, like I mentioned, and we did FMD as well to look at flow-mediated dilation. We also looked at fasting blood samples for for total LDL, HDL, cholesterol, glucose, insulin, and HbA1c, which I think the HbA1c data are not going to appear on the chart, but I can tell you what that said. And we also decided to measure flexibility before and after for this one. And this is what the sit and reach test actually looks like. It's kind of boring, but this is my coworker Mohammed. And so